So, hi friends, I'm Dr. Anshul Bansal, joining you on today's YouTube live session. As you all know, I am here to guide you for a preparation of orthopedics. We'll study orthopedics in depth here so that you can crack your NEET PG, INI, CET, other preparatory examinations as well as your Prof University examinations. We'll have special focus on the X-ray based, image based, and clinical scenarios, and we'll correlate orthopedic subject with different subjects also so that you can crack your next examination as well as your different pattern clinical based questions of your NEET PG. Currently, I am working as an orthopedic house surgeon in SMS Medical College, Jaipur, and I have cracked the NEET PG examination last year, that is in 2020. So I will also share you my experiences and will guide you through your journey for the NEET PG. Okay, so in today's session, as you all know, we'll be discussing high yield MCQs because NEET PG is round the corner. So we'll be discussing high yield MCQs for this year's NEET PG. So it will be a quick session, and MCQs are the best way to revise. So let's start today's session. And before starting this session, I would just briefly guide you through the various subscription plans available for NEET PG on Unacademy. The first one is the Iconic subscription plan. In Iconic subscription plan, you'll get access to all our live as well as recorded classes, QBanks, both of which are formulated by the best faculty in India for the NEET PG. You can also compete in live tests and quizzes. We'll allow you to log in with single account on multiple devices so that you can study on any device of your choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we'll be shortly providing them with our printed notes, and you can subscribe for this course using this code to get extra 10% off. Okay. Uh, the second one and the best one, not only best on the Unacademy but also on any digital platform, is your Iconic subscription. Apart from the things that I have mentioned earlier, in addition, you will get the Prep Ladder and all of the Prep Ladder, including its QBanks, video lectures, the rapid revision courses, the grand test, everything you will get. And on an Academy Extra, what you will get, we'll provide you with the live batch wise courses which are well structured and strategized in such a way so as to build your basic concept about any subject or topic first, and then going into its in depth and also correlating with other subjects. And also we'll provide you with individual assessment after every test, and that is very important so that you can find the your lacunas or the subjects or the subtopics in which you have to work harder or you are lagging behind. So it is a very good subscription package and you can avail this, and while subscribing you can use this code to get extra 10% off. Now, keeping in mind the various sets of students who are preparing for different sets of examinations, like some are focusing on FMG, some are focusing on next year's NEET PG or next examination. So dedicated to them, we have started individual courses for these students. So you can subscribe for these courses using this code to get extra 10% off. Okay, and as you all know, NEET PG is now hardly 2 weeks left. So at Unacademy, we have formulated a 1 month special package for NEET PG. And personally speaking, also, this is the best package available, and it contains all the things that you need for the last 1 month. It will have all the grand tests, the questions based on clinical scenarios, the image based questions, the recent advances or recent updates. Okay, and Also the last minute tips and tricks, the high yield MCQs or the high yield subtopics. So it will have everything, the rapid revision courses also. So you can subscribe for this packet, and you should subscribe. It is available for just 4,500. Okay, so go and grab this. And also, as I've told you many times, that last 1 month mein last time pe grand tests are very very important. So here is a schedule for a grand test. Okay, so please go for these grand tests. These are very important for your preparation. And not only giving the grand test, but also you need to read the theory or the explanation of every question which you have attempted or not attempted, correct or wrong, because this is the best way to revise, and you are doing it for the revision. Okay, don't get anxious about the marks, or don't get afraid ki I will lose time of revising my theory. No, this is the best way to revise. So please go and give grand test at least 3 to 4 grand tests per week. Okay, now for the students who will be subscribing for a plans of 12 months or more, we have a special limited time period offer for them, in which they will be provided with 2 months of that subscription package absolutely free. And also for a MBBS students subscribing, we have started a 4-year package, in which we are giving a limited time period heavy discount. Like the iconic subscription is available for just 75,000 for the entire 4 years. And for these students, I would like to suggest you to buy plan with longer duration of months, because as you can see, the cost per month decreases significantly if you increase the duration. And also, keeping in mind the next pattern, you need to focus on your theory part or your studies from the word go of the MBBS. So take plans which have longer duration, so that you can score well in your next examination. Now, special class, we have a special classes by all our educators. I do have special class on Wednesday. So these special class will give you extra edge over any other student. These are the extra edge classes where you will get live classroom like feel. You can interact with your educator, you can ask your doubts by just digitally raising your hand or participate in polls. We'll notify it about you regularly. And also you can watch it anywhere anytime, just by just logging to your YouTube, sorry, the Unacademy app. We'll also be providing you with the lecture notes in digital format. So what you have to do, you have to just download the mobile application of the Unacademy app and subscribe using via code, and both of which are absolutely free. So please go and watch special classes. These will give you extra edge over everybody else. We are also running a special bugs bounty program, in which if you find any error or inappropriate content in any of the slides of an educator, you can contact our team through the link given below, and if you are found correct, you will be awarded special offers and discounts. Okay, so quickly let's start the today's session. Usme, after reading the question, I will give you 15 seconds for every question to answer, and you can write your answers in the live chat box. Okay, so let's crack NEET PG with Unacademy. Okay, so here is your first question, and the question is, in which of the diseases is the following appearance of the calves seen in a child? Here are your 15 seconds. Okay, so the answer for this question is muscular dystrophy, and that to a very important one called as the Duchenne's muscular dystrophy. Here you can see in this calves there is, ऐसा नहीं लग रहा कि calves are increased in size, so this is like a hypertrophy, but it is called as pseudo hypertrophy. Okay, it is pseudo hypertrophy in Duchenne's muscular dystrophy. It is the most common muscular dystrophy. Okay, it is the most common muscular dystrophy, and there is pseudo hypertrophy of the calves because there is primarily what wasting or wasting of the thigh muscles. So वहां पे तो there is atrophy, so उसकी वजह से there is hypertrophy of the class calves. That is why it is called as pseudo hypertrophy. Okay, and remember, firstly it will involve the lower limb, and उसके बाद में next common site of the muscular hypertrophy will be tongue, followed by the forearm muscles. Okay, there are basically three major types of muscular dystrophies: the Duchenne's muscular dystrophy, the Becker's muscular dystrophy, and the limb girdle. So Duchenne's is the most common and the most important for examination. Age of presentation is between 2 to 3 years. Okay, it affects lower limb first, and then it affects your heart and respiratory muscles also, and if they are affected it can lead to the death also. Okay, and what is Becker's? It presents around 5 between 5 to 15 years of age, and it is slower progressive than the DMD, and it affects the hips and pelvic area first. Okay, then the heart को it involves. And what is limb girdle? ये उससे भी ज़्यादा एज में आएगी, over 30 years of age, and there is muscle weakness and atrophy in hips and shoulder. Okay, so ये होती है. See here you can see the Duchenne's muscular dystrophy. This is the atrophy of the forearms, atrophy of the hands, the hypertrophy of the calf muscles. Okay, so this is your Duchenne's muscular dystrophy. Read about them, go to your pathology का slide. देखो, I used to do this also कि our subject is लाइक कोरिलेशन कि हाँ एक टॉपिक बहुत सही जगह आएगा एंड एटलीस्ट ऑप्शंस में तो आ ही सकता है. सो उसके लिए इफ आई वो इट्स वेरी इजी टू टीच मी डकन्स हाइपरट्रोफी बिकॉज, बट क्या होता है कि वो रेलिवेंट नहीं होगा बिकॉज द बेसिक थिंग इज कि आप अपनी थ्योरी पार्ट का सोर्स बार बार चेंज मत करो एटलीस्ट एट द लास्ट मोमेंट. सो गो एंड रीड दीज muscular dystrophy from the place where you have read already, because if you'll understand it jaldi se and you'll also revise it more quickly. So it will take just 5 minutes. Go and read. Okay, so next question is, what is the most likely cause of the abnormality seen in the wrist x-ray as shown below? Here are your 15 seconds. Okay, it is a very good question, and the abnormality seen here it's D rickets due to vitamin D deficiency in child, और अगर adults में हो जाती है तो it is called as osteomalacia. And इसमें क्या होगा, इसमें there is hypertrophy or there is widening, sorry, not hypertrophy, there is widening of the growth plate, and due to this इस area पे क्या हो जाता है, slaying and cupping. Here you can see it is the cupping or the slaying. So what you do, metaphyseal and epiphyseal area पे you will have cupping and slaying of the bones. So this is a typical x-ray representing rickets in children. Okay, cupping and fraying of the metaphysis. There is widening and thickening of the growth plate, जिससे क्या हो जाती है, बोइंग हो जाती है. ओके, बोइंग हो जाती है. तो पैथोलॉजिकल फ्रैक्चर्स की बहुत चांसेस होते हैं. स्केफॉइड फ्रैक्चर, यू ऑल नो कि स्केफॉइड फ्रैक्चर अलग ही दिख जाएगा. देयर इज फ्रैक्चर ऑफ स्केफॉइड and avian के साथ बहुत commonly it will be associated. Here it is Pulleys fracture, which is extra articular fracture of the distal end of the radius, and C के बाद D आता है, so there will be dorsal tilt with dinner fork deformity. Okay, here you can see dinner fork deformity, and here are your presentation of the bones की rickets के अंदर bones कैसी हो जाती है. Rickets के अंदर you can see there is bowing of the, and here you can see weakness due to this is a pathological fracture, so there is bowing and pathological fracture in rickets. So 10 most clinical features, so इसमें सारे आ जाते हैं. So ये जो diseases होती है rickets, osteomalacia etc, these diseases को आपको एक कोई सा भी सब्जेक्ट पकड़ लो, वहां पे इनको आपको अच्छे से पढ़ना है, बिकॉज ओनली ऑर्थोपेडिक साइड से रिकेट्स पे क्वेश्चन आया तो सिर्फ ऑर्थोपेडिक के ऑप्शंस उसमें नहीं होंगे. सो यू नीड टू लर्न ओवरऑल. सो 10 मोस्ट इंपॉर्टेंट क्लिनिकल फीचर्स विल बी दे हैव वाइड suture line on the head, a special deformity called as craniotabes, rachitic rosary, Harrison sulcus, the prominent sternum, bowing of the legs, swelling of the wrist or the ankle joints, pectus carinatum, dental hypoplasia, frontal bossing, and delayed closure of the fontanelles. These are the typical clinical findings of the rickets. Very important. Okay. Now, next question. Next question is, a patient after a roadside trauma presented to the trauma center. He has a severe pain in his left hip, and on examination, the hip is exquisitely tender with restricted range of motion. The patient is lying in the posture seen below. Which of the following deformity is seen in the patient? 15 seconds. Okay, so the answer for this question is anterior hip dislocation, because here you can see there is history of hip trauma with this typical posture of the anterior hip dislocation where the hip joint is externally rotated, abducted. Okay, so and this is your anterior hip dislocation. So देखो ऐसे क्वेश्चन आए, so first of all don't get tensed, read them very patiently and you'll find one or two important clues. यहाँ पे तो पिक्चर ही अपने आप में clues था, but in completely theoretical clinical questions also you'll get one or two very straightforward clues. So from that clues you can easily guess the answer, and ज़्यादा दिमाग नहीं लगाना है ऐसे क्वेश्चन में firstly, and read the question very carefully. अब इसमें भी क्या होता है, some students don't read the theory of the question वेरी केयरफुली, बिकॉज उनके सामने इमेज आ जाती है, तो इमेज देखते हैं उनका ध्यान वहां चला जाता है, एंड दे ट्राई टू गेस द आंसर फ्रॉम दैट इमेज आल्सो. नो, पेशेंटली पहले थ्योरी रीड करो, देन see the image. Okay, so this is anterior hip dislocation. Hip dislocation में most common type is the posterior hip dislocation. In anterior dislocation the legs will be externally rotated, abducted and slightly flexed as seen in the image. Okay, and posterior में there is shortening of the limb, but in anterior dislocation there is no shortening of the limb. Okay, so यहाँ पे क्या होता है, why there is no shortening? Because there is attachment of rectus femoris muscle, जिसकी वजह से the head जब displace होता है, so it prevents its upwards displacement. Okay, so leg is abducted and कई बार it forms a right angle also, like in this image. So it is a typical image of posture of anterior hip dislocation. Okay, and hip movements obviously will not be possible. This is your anterior hip dislocation. And what will be the treatment of choice in any dislocation or in any dislocation of the joint? The treatment of choice will be, first you have to go for the closed reduction. Okay, so the treatment of choice will be immediate closed reduction. Okay, this is your posterior hip dislocation here. This is your posterior hip dislocation, most common type of hip dislocation. and इसके अंदर जो posture होगा वो कैसे होगा? It will be internally rotated and adducted. Okay, internally rotated and adducted, very important. Okay, so this is your posterior dislocation of the hip. And another one which is the rarest is the central dislocation of the hip, in which there is also fracture of the acetabulum. Okay, so next question. A boy presented with pain in his right hip. A pelvic x-ray was taken and is shown below. What is the most likely diagnosis? Here are your 15 seconds. Okay, so it is a very good question, and इसका जो आंसर है, it is B, osteopetrosis. Because osteopetrosis में क्या होगा? Osteopetrosis में there will be thickening or sclerosis of the entire bone. So यहाँ पे आपको दिख रही है, there is sclerosis and thickening of the entire bone. So this is osteopetrosis. Osteoporosis में क्या होगा? There will be decrease in the bone mineral density. तो इतना whitish की जगह there will be more blackish, because the bone will get weak. In osteogenesis imperfecta and in osteopoikilocytosis में क्या होगा? आपको ये bone के अंदर you will see these random areas of calcification like things. This will be, or we'll have image of everything in the later slides. So what is osteopetrosis? Osteopetrosis is the thickening or the sclerosis of the bones which have increased radiographic density. And वो किसकी वजह से होता है? Because there is imbalance between bone formation and bone resorption, और इसमें bone resorption is increased. Okay, osteopetrosis में the basic pathology is there is increased bone resorption. There is increased bone formation because the bone resorption mechanism is hindered due to defect in the osteoclast production. So the major pathology is in the osteoclast, not in the osteoblast. Or pathology in the osteoclast में है, what pathology? There is a defect due to which bone resorption cannot happen normally. Okay, so osteopetrosis, also known as marble bones, because इसमें जो bones होती है they look like a marble, बिल्कुल white हो जाती है. And also known as Albers-Kornberg diseases. Okay, so this is a very important disease, and X-ray में देखते ही you can identify कि हाँ ये तो osteopetrosis ही है. See here, it is your healthy bone with healthy thickness, and this is your osteopetrosis वाली bone. See, marble bones बहुत स्क्लेरोसिस हो जाता है. सो ऑस्टियोपेट्रोसिस में होता क्या है? ऑस्टियोपेट्रोसिस इज अ जनरलाइज्ड और सिस्टमिक डिजीज हो जाता है. बेसिकली बोन में होता है, बट इट हैज many manifestations also. So इसमें क्या होता है? The osteopetrosis, there is generalized bones osteosclerosis. So due to this, bone become hard, but they are not that strong in terms of tensile strength. So there is high chances of pathological fractures which go into non-union and malunion. It is a stony brittle bone. Okay, and there is impaired osteoclastic function. So bone resorption जो होता है वो नहीं हो पाता है. Okay, so there is genetic mutation in कार्बोनिक एनहाइड्रेस 2 चैनल जो होता है उसके जीन्स में जेनेटिक म्यूटेशन होता है. सेकेंडरी इन द क्लोराइड चैनल, बस मोस्ट इंपॉर्टेंट इन द कार्बोनिक एनहाइड्रेस 2 जीन के अंदर होता है. सो देयर इज डेंस बोन, बट इम्पॉर्टेंट चीज एक और ये होती है कि द बोन इज इवनली डेंस, ओके, पूरी की पूरी बोन इवनली डेंस होती है, एंड देयर इज नॉर्मल ऑस्टियोब्लास्टिक एक्टिविटी, सो ऑस्टियोब्लास्टिक एक्टिविटी नॉर्मल होती है, रिमेंबर, ओके। सो इसमें क्या होता है, ब्लड के अंदर यू विल हैव द पेनसाइटोपिनिया, बिकॉज बोन मैरो का फंक्शन विल बी हिंडर्ड, एंड देयर विल बी एक्स्ट्रा, उसको उसकी मेकअप करने के लिए यू विल हैव टू डू द एक्स्ट्रा मेडुलरी एरिथ्रोपोइसिस, सो देयर विल बी फ्रंटल बॉसिंग, हिपैटो एंड स्प्लीनोमेगाली, देयर विल बी ऑब्वियसली बोन पेन, एंड देयर आर, हियर यू कैन सी मार्बल बोन पूरी की पूरी वाइट हो चुकी है, स्क्लेरोज्ड हो चुकी है, एंड सच bone in of the or such vertebral bones are called as the sandwich vertebra, as you can see in the image, sandwich vertebra. And what is the treatment? The supportive treatment is your blood transfusion to correct the pancytopenia, dental and the orthopedic care, etc. is your supportive treatment, but these are not definitive, है ना? The definitive treatment is your stem cell transplantation or the hematopoietic stem cell transplantation, okay, remember this. And other functions में क्या होता है कि obviously there is sclerosis, so very important nerves अपने स्कल के अंदर फोरामेंस होते हैं, एज यू ऑल नो, उन उनमें से वेरी इंपॉर्टेंट नर्व्स पास, so obviously there is sclerosis, so there will be decrease in the diameter of these foramens, leading to the compression or the palsies of very important cranial nerves, so there can be hearing impairment or the visual impairment or the facial palsy, okay, due to the narrowing. There will be poor dentation, and if it affects the mandible, there can be mandibular osteomyelitis also due to its abnormal vascular supplies, where the sinuses will be malformed, okay, so nasal congestion and stuffy nose hoga, okay, and there will be frontal bossing, okay. So this is your osteoporosis. Now, what is osteogenesis imperfecta? Osteogenesis imperfecta is an inherited genetical bone disease which is congenital, and it is also called as the brittle bone disease, okay. Osteoporosis में भी bone brittle हो जाती है, but they are stony brittle, and brittle bone disease term is used for osteogenesis imperfecta because यहाँ पे क्या होती है, soft bones होती है and which fracture very easily, and bones are not formed normally, है ना? जो नॉर्मल बोन का स्ट्रक्चर होता है उसके हिसाब से बोन इज नॉट फॉर्म्ड, सो देयर आर ब्रिटल बोन डिजीज बट सॉफ्ट बोन्स, okay, it is osteogenesis imperfecta. Now what is osteopoikilocytosis? This is a bony dysplasia which is sclerosing type of bony dysplasia. So यहाँ पे ऐसे areas of calcification you can see dysplasia और benign endostosis होते हैं, and this is a benign conditions easily found on the x-rays which are incidental findings. ज़्यादा signs and symptoms नहीं होते हैं, there is no pre-malignant potential, but you have to remember what is osteopoikilocytosis and its x-ray finding, okay. So ये इतने सारे x-rays है, very different types, so you can either take the screenshot or you can save in your gallery, and just 50-100 images एक दिन में देखना, 50 to 100 images देखने में आपको 15 to 20 मिनट से ज़्यादा नहीं लगेंगे, and it is the best way to revise. So use this study pattern also. I used to study also कि waiting for my dinner or for my lunch, I used to just open my gallery and 5 minutes में 20, 30, 40 जितने भी image I could see them. Okay, so this is the best way to revise, especially in the last 15 to 20 days. Okay, so coming on to the next question. The next question is, the following x-ray was taken of a 16-year-old boy. What is the most likely pathology seen here? Here are your 15 seconds. Okay, so the answer for this question very easy is the chronic osteomyelitis. Okay, Ewing sarcoma में ऑस्टियोसार्कोमा एंड acute osteomyelitis इन तीनों में डिफरेंशिएशन कैसे करना है वो अपन बताएंगे. So सबसे फर्स्ट इज यहाँ पे you can see three typical findings of chronic osteomyelitis. This is your involucrum, that is the new bone formation. This is your sequestrum, that is the dead bone formation, dead bone. And here it your sinus or the cloaca, ठीक है, जिसमें से sequestrum and the pus comes out. So these are the three typical things that you can see in the chronic osteomyelitis X-ray. So this is a X-ray of chronic osteomyelitis. Okay, now in Ewing sarcoma, what you will see in Ewing sarcoma, you will see a isolated lytic lesion, which periosteal reaction here, but not that great that in osteosarcoma, but yes, periosteal reaction will be there with a lytic lesion. Okay, it basically most commonly affects the नी के अराउंड वाला बोन्स जो होता है, इट मोस्ट कॉमनली इफेक्ट्स this is Ewing sarcoma, and it has to be differentiated with the chronic osteomyelitis because Ewing sarcoma में भी फीवर होता है. Okay, fever is very common complaint in Ewing sarcoma. That's why chronic osteomyelitis is a very important differentiation. And here also you can see the Codman's triangle due to that न्यू बोन फॉर्मेशन. बट यहाँ पे पेरियोस्टियल रिएक्शन जो होती है, द पेरियोस्टियल रिएक्शन is regular and it is in form of layers, so there is very important onion peel appearance. Okay, there it is very important onion peel appearance, whereas in osteosarcoma periosteal reaction is very intense. So the periosteal reaction is very intense and it breaks the periosteum and shifts to the soft tissue, so it is irregular and it gives a typical sun ray appearance. Okay, this is your osteosarcoma. And most commonly osteosarcoma कहाँ पे होता है, pelvis के अंदर होता है. But if it affects the long bones, it is most commonly in the diaphyses, whereas Ewing's is in the metaphyses most commonly. Okay, see, abnormal irregularly बहुत ही intense periosteal reaction देखते ही you should diagnose the osteogenic sarcoma. Okay, सो व्हाट इज ऑस्टियोमाइलाइटिस, बोन एंड बोन मैरो के इन्फेक्शन को ऑस्टियोमाइलाइटिस बोलते हैं. अक्यूट, सब अक्यूट, क्रॉनिक 3 स्टेजेस में होता है. वील्स हैव क्रॉनिक. नाउ अक्यूट और क्रॉनिक को कैसे डिफरेंशिएट करें. फर्स्ट ऑफ ऑल अक्यूट में पहले के ऑस्टियोमाइलाइटिस की हिस्ट्री नहीं होगी, प्लस इन अक्यूट cloaca and involucrum like things will not be there. In acute sequestrum can be there, not a typical finding of acute, but still it can be there, but involucrum and cloaca wali radiological findings will not be there. Obviously acute mein the signs of inflammation or the clinical features will be more intense. Okay, so there can be and acute में पुराना कोई साइनस या ट्रैक नहीं मिलेगा आपको, बट इन क्रॉनिक you have a history as well as a पुराना कोई ट्रैक या साइनसेस in the affected bone you can see. Okay, so what is the treatment of choice? The treatment of choice is excision of the necrotic bone, that is sequestrectomy, और अगर कैविटी बन गई है तो उस कैविटी को भी हटाना होता है, that is saucerization, and go sending that sample for the culture sensitivity, antibiotics, and if the defect is large you can also do grafting etc in those. Okay, so this is your chronic osteomyelitis, very important. See, here it is your chronic osteomyelitis. and here it is your acute osteomyelitis. Okay, it will present you as a lytic lesion, most commonly in the metaphyseal area, because यहाँ पे blood supply सबसे ज़्यादा होती है. So hematogenous रूट से ही मोस्ट कॉमनली होता है, तो हिमेटोजिनस रूट से कोई भी पैथोजन आने के चांसेस भी सबसे ज्यादा यहीं पे होते हैं. सो इट इज योर अक्यूट ऑस्टियोमाइलाइटिस. एंड क्रॉनिक ऑस्टियोमाइलाइटिस का मोस्ट कॉमन रीजन जो होता है, इट कैन बी प्राइमरी और सेकेंडरी. तो प्राइमरी कैन बी from the acute, it converts into the subacute and the chronic hematogenous roots, and secondary is due to compound or open fractures. Okay, this is your, see here you can see this is your secondary chronic osteomyelitis. Okay, so I think this is clear. Now coming to the next question. An athlete suffers a fracture as shown in the knee x-ray below. How is this fracture managed? Here are your 15 seconds. Okay. So first of all, what is this fracture? This fracture is fracture patella. Okay, so iska treatment of choice is the tension band wiring, that is TBW. Okay, so here you can see in the AP view, here is the fracture patella. It is a skyline view to see the patella. Important view, skyline view patella. Here you can see patella. This is the osteochondral part of the patella. This is your femur. Okay, this is your femur. So the, if it is undisplaced or two-part fracture, conservatively it can be managed, but the treatment of choice for these question, क्योंकि conservative management तो option में ही नहीं है, so it is the tension band wiring or the TBW. So tension band wiring जो होती है वो most importantly 3 types of fractures in the body में आप करते हो. First is the fracture patella that we have seen. Second is the fracture of olecranon, and third is the fracture of medial malleolus. Okay, in 3 fracture mein you do tension band wiring. Okay, so what is tension band wiring? The सबसे पहले you put a K wire in the fracture segments. Okay, firstly you put a K wire to reduce the fracture segment and stabilize it, and then this reduced part via the K wire, it is fixed, or it is fixed using a tension band, the SS wire, like this. So this is your tension band wiring. So this tension band technique, it converts the tensile strength of the wires into a compressive force, and so इसमें stability ज़्यादा होती है. Okay, here you can see the tensile strength is converted into the compressive forces. This is a tension band wiring of the patella. Here you can see in the lateral view. Okay, and also this is compression plates. Here also the compression is done, but not by the tensile strength of the wire, but by the screws. And patella, olecranon या medial malleoli ऐसे पार्ट से बोन के ऑब्वियसली ऑल्सो यू कैन सी कि वहां पे प्लेट लगाना इज नॉट पॉसिबल. ओके, दे आर कर्व्ड स्ट्रक्चर्स, सो यहाँ पे टेंशन बैंड वायरिंग करनी होती है. सो एंड ऑल्सो in tibia etc, this compression force is done by the interlocking nail. So here is your next question. Next question is, the following deformity shown in the picture is likely to be a complication of which of these? Okay, here are your 15 seconds. Okay, here you can see first of all which is this deformity. You can see this is a cubitus varus deformity. वेलगस में लेटरली जाता है एल से एल, वेरस में देखो मीडियली जा रहा है. And this is your carrying angle between long axis of humerus and long axis of ulna. Okay, so carrying angle is decreased. This is cubital varus looking like a gun stock, also called as the gun stock deformity, and it is seen in as a late complication or the malunion of supracondylar fracture of humerus. Okay, supracondylar fracture of humerus. So very important for your examination point of view, the cubitus varus or gun stock deformity. ऐसे dinner fork deformity Cooley's fracture में होती है. Okay, it is a late complication and most common complication of supracondylar humerus. But अगर आपसे पूछे most common early complication of supracondylar humerus, it will be the nerve injury, and that too most commonly of the median nerve, and it will present you like this pointing index wala. Okay, but most common complication or most common late complication will be the gun stock deformity due to malunion of the supracondylar fracture. And for correction, mostly by physiotherapy etc it can be corrected, or normal काम चल जाता है, but it is, if it is very large, so you have to do a wedge osteotomy for this. Okay, you have to do a wedge osteotomy, and इस osteotomy का एक very important नाम है, that is French osteotomy. Okay, very important, French osteotomy. See here you can see what is this now. Which fracture is this? This is your fracture of lateral condyle of humerus. और ये कैसे पता लगाया है? सबसे पहले अगर यहाँ पे होता तो सुप्राकॉन्डाइलर होता. अब ये लेटरल कॉन्डाइल है, कैसे पता लगाया? या सी हियर, दिस इज योर रेडियस. Okay, so ये radius है, so radius will be the lateral part, so this is your lateral condyle humerus का fracture. This is your Monteggia. कैसे याद रखा था Monteggia and Gallizzi को? GRD. Okay, so GRD, Gallizzi is, what is Gallizzi fracture? Gallizzi fracture is fracture distal 1/3 of radius with dislocation of the distal radio-ulnar joint. And what is Monteggia? Monteggia will be proximal 1/3 or upper 1/3 of ulna का fracture with fracture of radial head or dislocation of the radial head. And most commonly the dislocation is anterior or the extension type, and it is बाडो टाइप 1. याद रखना बाडो सिस्टम होता है, इट इज बाडो टाइप 1, एंड इसका रिवर्स यानी पोस्टीरियर, दैट विल बी दी रिवर्स Monteggia fracture dislocation, and it is बाडो टाइप 2. Okay, now here you can see this is the normal anatomy or radiography of the elbow joint, very important. This is your radius, radial head, so this is your lateral condyle, this is your medial condyle, this is your ulna, and this is your olecranon. Okay, and this is your coronoid process on the ulna, the radial tuberosity. Okay, and here you have the capitulum. What is capitulum? ये वाला जो पार्ट है, this part and this part. Okay, so remember this part जहाँ पे radius attach होता है on the humerus, it is called as the capitulum, and this part where ulna is attached, this part is called as the trochlea. Okay, here you can see what is this fracture, radius head का fracture है. Okay, this is a fracture of radius head, this is supracondylar humerus, and इसके एक और important characteristic होती है the 3 bony point relationship is maintained in supracondylar humerus fracture, because we have studied if you flex your elbow, so there are three bony points, one of the medial condyle, lateral condyle, and the tip of the olecranon, like an isosceles triangle, or extend karte hain to this is vanished. And in semi flex a fourth bony point भी you can feel, and that is your radial head, fourth bony point, ये ध्यान रखना. So this is maintained, relationship is maintained in supracondylar, because ये देख लो यहाँ से fracture हुआ है, so this medial and the lateral condyle as well as your olecranon, ये तो सब इसी position में ही है, forming an isosceles triangle. Okay, so the next question is, osteoclasts have all of the following except, here are your 15 seconds. Okay, so the answer for this question is B, that is receptor for the parathormone. Osteoclast bone resorption करता है, yes. उनकी ruffled border होती है, yes. Associated with rank ligand, yes. Receptor for parathormone, no. ये बहुत important question है. Actually में होता क्या है कि parathormone does bone resorption, it is absolutely correct. And bone resorption is the function of osteoclast, yes, it is also correct. बट एक विचित्र बात ये आती है कि बट पैराथॉर्मोन के लिए रिसेप्टर्स होते ही नहीं ऑस्टियोक्लास्ट पे, तो कैसे एक्ट करता है? पैराथॉर्मोन पहले जाता है ऑस्टियोब्लास्ट के पास, सो ऑस्टियोब्लास्ट हैव द पैराथॉर्मोन के रिसेप्टर्स, एंड वाया द रैंक लिगेंड ये कम्युनिकेट करते हैं ऑस्टियोक्लास्ट से. So via the rank ligand, these increase the osteoclast or activate the osteoclast progenitors, and then the resorption happens. Okay, so very important question and concept, remember this thing. Okay, so principal mediators of bone resorption are the osteoclast. And osteoclast कैसे होते हैं? ruffled border होती है, so infolded plasma membrane होती है, and there is a free zone, and these do bone resorption by rank mechanism. Okay, so rank जो होता है, rank that binds to the rank ligand and that stimulates the bone resorption. So parathormone receptors osteoblasts पे होते हैं. तो okay, तो parathormone जो होते हैं receptors, it is a G protein coupled receptors called as PTHRP1. Okay, very important, and ये majorly bones पे, kidneys पे and cartilages पे होते हैं. Okay, here you can see the ruffled border of the osteoclasts. Okay, and it is कौन सी, जो जहाँ जिस surface पे resorption हो रहा है bone का, उस surface पे they will be the ruffled border. Okay, here the resorption lacuna, and these will secrete the hormone, the enzymes, and that will do the resorption of the bone. Here is the mechanism through the bone, the rank ligand. Now the next question is, PTH parathormone directly acts on which cells? Okay, very important, similar question like this. Here are your 15 seconds. So very easy, we have discussed right now. PTH directly किस पे act करेगा? They act on the osteoblast. Okay, PTH directly act किस पे करेगा? Osteoblast पे, which will secrete mediators and stimulate the osteoclast for bone resorption, and this is called as osteoclastogenesis. Okay, this is called as the osteoclastogenesis. Now next question is, most vascular zone of the bone is, we have discussed this in the previous slides, so here are your 15 seconds. So the answer is metaphysis. Okay, so the answer is metaphysis. The most vascular zone of the bone is the metaphysis. Okay, क्योंकि यहाँ पे क्या होता है, the arteries, they come in bulk and they form the arterioles and the venules form the hairpin shaped loops. So इसकी वजह से there is increased blood supply, but it is most common site of osteomyelitis also, because blood supply ज़्यादा है तो hematogenous route से pathogens ज़्यादा आएंगे, and also there is sluggish blood flow due to these hairpin shaped loops formed by the arterioles and the venules in the metaphyseal region. Okay, so very important. And here you can see now diaphysis पे एक nutrient foramina होता है जिससे एक nutrient artery आती है, and this nutrient arteries has the ascending and the descending branches as you can see in the diagram, and then they anastomosis with the epiphyseal and the metaphyseal vessels. So nutrient artery important याद रखना. So nutrient artery, it is a high pressure system. जो systemic जो major arteries होती है उनमें से एक tributary या एक branch निकल के आ जाती है. This is your nutrient artery. Okay, very important for the supply of the diaphysis. Okay, now next question is, snapping knee syndrome is it due to involvement of, here are your 15 seconds. Okay, so the correct answer for this is snapping knee syndrome is due to involvement of pes and serenius. Okay, तो सबसे पहले what is snapping knee syndrome? Snapping knee syndrome में what you have an abnormal painful clicks or catching sensations whenever you flex or extend your knee, and it happens because there is an hip instability. So hip instability is present. So to compensate it, इस hip instability को compensate करने के लिए there is tension in the TFL, tensor fascia lata, and this leads to the snapping knee syndrome. And snapping knee syndrome में most commonly pes and serenius group of muscles involved होती है. And what is pes and serenius? इसमें 3 important muscles होती है. Okay, कौन कौन सी? Sartorius, gracilis and the semitendinosus. Okay, sartorius, gracilis and the semitendinosus, also called as the goose foot. ओके, इट इज अ कॉन्जॉइंट मीडियल नी टेंडेंस जो कि एंटीरियो मीडियल एस्पेक्ट ऑफ द प्रॉक्सिमल टिबिया पे अटैच होती है. जो एंटीरियो मीडियल कंपार्टमेंट की ही मसल से थाई की. सो दिस इज योर पेस एंसेरेनियस. एंड पेस एंसेरेनियस पे एक और क्वेश्चन आ सकता है, दैट इज अबाउट इट्स बर्साइटिस. ओके, सो पेस एंसेरेनियस बर्साइटिस इज वेरी कॉमन, एंड इसमें यहीं पे इन्फ्लेमेशन होगा एंड सारे सिम्टम्स ऑफ बर्साइटिस होंगे. नथिंग इम्पॉर्टेंट हियर. इसमें अब इम्पॉर्टेंट थिंग इज व्हाट इज इट्स कॉज. सो इसका कॉज जो होता है वो होता है नेग्लेक्टेड और इम्प्रॉपर एक्सरसाइजेज और द जिमिंग. इसलिए अगर जिम आप बोलते हैं कि जिम के बाद इट इज़ वेरी इंपॉर्टेंट टू डू दी स्ट्रेंथनिंग एक्सरसाइजेज के बाद इट इज़ वेरी इंपॉर्टेंट टू डू दी स्ट्रेचिंग ऑफ द मसल्स. ओके, बिकॉज मोस्ट कॉमन कॉज ऑफ पेंस एंड सेरेनियस बर्साइटिस इज द नेग्लेक्शन ऑफ द स्ट्रेचिंग ऑफ द मसल्स आफ्टर योर जिमिंग सेशन. ओके, सो इट इज़ वेरी इंपॉर्टेंट. Now next question, and very easy question, is tennis elbow is characterized by, here are your 15 seconds. Okay, so the answer is B, tendinitis of the common extensor origin, because we know कि tennis elbow lateral epicondylitis कराती है, and there इसमें जो लेटरल एपिकॉन्डाइलाइटिस एंड वहां पे एक इंसर्शन और अटैचमेंट, सॉरी ओरिजिन होता है, नॉट इंसर्शन, ओरिजिन ऑफ द कॉमन एक्सटेंसर टेंडन्स. ओके, सो due to this there is inflammation of these extensor tendons and micro tearing of these tendons, leading to the tennis elbow condition. And most commonly involved tendon is that of the extensor carpi radialis brevis. Okay, sorry, radialis longus. So extensor carpi radialis longus जो होता है, no, it is brevis, I guess. Yes, it is brevis. Sorry, I am also confused. So yes, एक्सटेंसर कार्पाई रेडियलिस ब्रेविस का सबसे कॉमनली टेंडन इन्वॉल्व होता है. एंड यहाँ पे एक यू हैव दिस फॉर इट्स ट्रीटमेंट टेनिस एल्बो बैंड. एंड व्हाट इज इट? इज अ सर्कुलर बैंड लाइक दिस. एंड दिस सर्कुलर बैंड क्या करता है, जो लेटरल कॉन्डाइल पे कॉमन एक्सटेंसर्स का अटैचमेंट होता है वहां पे इट compresses, keeps it compressed so that there is no rupture of the extensor tendons, and also वहाँ पे वो compact रहे and there is immobilization so that they can heal. Okay, this is your tennis elbow. And medial epicondylitis is called as the golfer's elbow. Very important. Now the next question is flexor digitorum profundus tendon avulsion injury leads to. Very important. Here are your 15 seconds. Very confusing ये वाली finger वाली injuries, but very important. So take your time and answer. ओके, सो द आंसर इज जर्सी फिंगर. सी मैलेट फिंगर में ऐसा हो जाएगा, तो अगर मैलेट फिंगर में ऐसा है, रिमेंबर मैलेट फिंगर वो सबको याद रहता है कि मैलेट फिंगर में ऐसा है. So mallet finger is like this, it remains in the flexion, so obviously there is rupture of the extensor tendon. Okay, and इसका उल्टा is the jersey finger where there will be a rupture of the flexor tendon, that to flexor digitorum profundus. Gamekeeper thumbs, you know thumb है, तो यहाँ पे ulnar collateral ligament if there is forceful abduction, and bottomless deformity and swan neck deformity we will see अभी. So it is jersey finger due to flexor digitorum profundus के tendon की injury की वजह से, and mallet finger is due to extensor digitorum tendon की avulsion injury की वजह से, and gamekeeper's thumb due to ulnar collateral ligament of the thumb. एंड बेनेट्स फ्रैक्चर में क्या होता है, इट इज इंट्रा आर्टिकुलर फ्रैक्चर ऑफ द बेस ऑफ फर्स्ट मेटाकार्पल. okay, and base of fifth metatarsal is Jones fracture. Here you can see this is the jersey finger, and this is your gamekeeper's thumb, also called as the skier's thumb due to forced abduction यहाँ पे first metacarpophalangeal joint पे. So there is avulsion fracture ulnar collateral ligament के rupture के साथ में. This is your mallet finger, and here you can see mallet finger पे जो DIP joint है. First of all joints देख लो. This is your metacarpophalangeal joint. This is your proximal interphalangeal joint, या इसको middle interphalangeal joint भी बोल देते हैं, तो दोनों चीजें इसी के लिए यूज होती है. And this is your distal interphalangeal joint. Okay, so सिर्फ distal interphalangeal joint में flexion है, so this is your mallet finger. And in swan neck ऐसे याद रखो इमेज मेमोरी के थ्रू कि यस स्वान नेक इज स्वान जैसी नेक होगी, सो देयर विल बी फ्लेक्शन एट द DIP, बट जो PIP है देयर विल बी द हाइपर एक्सटेंशन. ओके, एंड इन bottomless deformity there will be flexion of PIP with hyper extension of the DIP like this. Okay, This is your Botania's deformity. Very important. Last time पे ऐसी photos you take a screenshot and just revise them in 2 or 3 days. You will never forget. अभी जाके आप सोचो कि 10 days बाद मेरे को ये याद रह जाए. It is very difficult. Okay, so just remember these things, important for your examination. Now the next question is, H reflex is useful in diagnosing. Here are your 15 seconds. Okay, so the answer for this question is SI radiculopathy, that is sacroiliac or the sacrum radiculopathy. तो H reflex जो होता है वो SI radiculopathy के लिए यूज होता है, and that too it is recorded in the soleus muscles. Okay, in soleus muscles, and the stimulation is given to the tibial nerve. Okay, and generally क्या होता है, the H reflexes are absent bilaterally in elderly patients or chronic diabetes with polyneuropathy etc. But if it is unilaterally absent na, then it is points towards the diagnosis of the S1 radiculopathy, the sacrum 1 radiculopathy. Okay, the sacrum 1 radiculopathy. Okay, so it is important. बस आपको इतना ही ध्यान रखना है, इसके अलावा ज़्यादा याद नहीं रखना है. Now next question, very easy question is, postmenopausal women first line of drug for osteoporosis is. I guess every one of you know, very easy. The answer for this is the bisphosphonates, the dronates. Okay, and they are given like every 6 months. Okay, and इनको देने से पहले एक important चीज तो याद रखनी पड़ती है कि while sitting you have to give it, and just after giving it at least 3 to 4 hours तक आपको बेड पे लेटना नहीं होता है, because there are high chances of gastritis. There are high chances of gastritis. These are your dronates or the bisphosphonates. Okay, एंड व्हाट इज रिलॉक्सिफिन, ये एक सेलेक्टिव एस्ट्रोजन रिसेप्टर मॉड्यूलेटर होता है, एंड इट इज hormonal preparation, not the first line, but yes, it is used for the treatment of osteoporosis. Now the next question, named fracture match it. Okay, what is this fracture? Here are your 15 seconds. वेरी इजी, दिस इज योर बॉक्सर्स फ्रैक्चर. बॉक्सर्स फ्रैक्चर में क्या होगा, फिफ्थ ऐसे मारोगे तो यहाँ पे फिफ्थ मेटाकार्पल का नेक, इट इज योर बॉक्सर्स फ्रैक्चर, मोस्टली एक्स्ट्रा आर्टिकुलर. सो दिस इज योर बॉक्सर्स फ्रैक्चर. जोन्स फ्रैक्चर क्या होता है, जोन्स फ्रैक्चर इट इज अवल्जन फ्रैक्चर ऑफ द फिफ्थ मेटाटार्सल base. It is your Jones fracture. And what is March fracture? It is a type of stress or fatigue fracture, and इसमें क्या होता है, due to repetitive chronic stress second और third metatarsal shaft पे एक hairline fracture हो जाता है, which is not seen easily. आपको बहुत गौर से एंड क्लिनिकली साइट ऑफ द पेन एंड स्वेलिंग को कोरिलेट करके फिर देखना होता है. दिस इज योर मार्च फ्रैक्चर. व्हाट इज बेनेट्स फ्रैक्चर? फर्स्ट मेटाकार्पल बेस का इंट्रा आर्टिकुलर फ्रैक्चर, इट इज योर बेनेट्स फ्रैक्चर. एंड ऐसे ही फर्स्ट मेटाकार्पल बेस बट extra articular fracture, it is your Ronaldo fracture. Okay, it is your Ronaldo fracture. Okay, here it is first metacarpal, but extra articular, it is your Ronaldo, it is your Bennett's fracture. ओके, सो वेरी इंपॉर्टेंट, ये नेम वाले फ्रैक्चर बहुत इंपॉर्टेंट होते हैं ना. आई विल हैव अ सेशन इन द कमिंग डेज जस्ट बिफोर द एग्जामिनेशन जहाँ पे मैं सारे एक्सरेज अराउंड आई विल टेक 100 एक्सरेज जिसमें आई विल कवर द मोस्ट इम्पॉर्टेंट एंटायर ऑर्थोपेडिक्स. सो यस, वो प्लीज सेशन अटेंड करना. Now the next question is plaster for Cooley's fracture sequences. किस sequence में Cooley's fracture का cast we will put? Here are your 15 seconds. So the sequences, सबसे पहले we will give the traction, then we will reduce the fracture by palmar flexion, then we'll do the ulnar deviation, and then at the last we'll put the POP. So the answer for this is 4 followed by 1 followed by 2 followed by 3. Okay, this is your answer. A very important police cast का reduction technique, it is very important. Shaking hand के form में you first give the traction, sustained traction देके रखना is important so that muscles relax हो जाए. Then you have to palmar flex the hand, and then you have to adjust the dislocated distal fragment by manipulation. Okay, you have to feel both the styloids सही जगह आ गए हैं क्या. Then you have to put into the ulnar deviation, that is in the medial side, and put a Foley's cast like this. Okay, very important. This is your Foley's cast ka method. Okay, traction, then palmar flexion, then ulnar deviation, then the cast or the slab. और पहले आप slab लगाते हो for the first 7 days so that swelling वगैरह subside हो जाए. Then you convert it into a cast. Now next question is calcification of the intervertebral disc is present in. Here are your 15 seconds. Okay, very easy. Intervertebral disc का calcification is a characteristic finding of ankylosing spondylitis. Okay, here you can see intervertebral disc हो गया, जिससे it has a special feature very important called as the bamboo spine. And ankylosing spondylitis, या नाम याद आने से ही you have to remember one thing. नाम आते ही आपको एक चीज याद आनी चाहिए, and that is HLA-B27. Okay, HLA-B27, it is an autoimmune disease, and firstly it involves the sacroiliac joint. And इसमें typical pain कैसा होता है, इसमें pain gives a very typical presentation, like it is absent when doing work and it is present when sleeping or resting. So it has a typical history of late night or early morning pain, या सो नहीं पाते ऐसे patient, and there is very intense pain, so they take NSAID. So NSAID induced chronic renal failure is very common. Okay, this is about the ankylosing spondylitis, very important. Okay, and ये calcification start कहाँ से होता है, it is also important that where this calcification start. It starts as enthesitis. Now, enthesitis is inflammation of enthesis. Now, what is enthesis? Enthesis is वो पार्ट ऑफ द बोन जहाँ पे टेंडन्स, लिगामेंट्स या मसल्स अटैच आके होती है, अटैचमेंट पॉइंट ऑन बोन, ठीक है, जहाँ पे सारी चीजें बोन पे आके अटैच होती है ना, उस पार्ट को बोलते हैं एंथेसिस, और वहां पे इन्फ्लेमेशन को एंथेसाइटिस, और इट स्टार्ट्स एज एंथेसाइटिस, देन calcification, and it starts at the sacroiliac joint. It is a systemic disease which involves reactive urethritis or reactive erythrocyclitis also. There can be knee joint osteoarthritis, that too very intense. Okay, so these are the symptoms of the or clinical findings of the ankylosing spondylitis. Okay, now these were the questions. As you can see, हमने questions discuss किए हैं, and all these questions were clinical based with history or image or x-ray, and इस type के questions आएंगे. All questions were conceptual, जो आपने पढ़ रखे हो, except one or two questions like that. I have included that S1 radiculopathy वाला H test. वो मैंने क्यों इंक्लूड किया? बिकॉज आई हैड टू गिव यू अ एग्जामिनेशन वाली फील कि वो नहीं आता है, तो दैट ऑप्शन was not meant to be attempted. Okay, ऐसे क्वेश्चन छोड़ने के लिए होते हैं. तो एटलीस्ट 200 में से 180 to 190 क्वेश्चंस आपको अटेम्प्ट करने हैं, एंड ऐसे जो 10 क्वेश्चंस या 15 क्वेश्चंस होंगे जिनमें आपको एक ऑप्शन की भी हवा नहीं होगी, लीव देम, उन पे तुक्का नहीं मारना है. अगर आपको एक या दो ऑप्शन भी यू कैन हटा सकते हो, तो अटेम्प्ट दोस क्वेश्चन. तो एटलीस्ट 180 to 190 क्वेश्चंस यू हैव टू डू फॉर एग्जामिनेशन. ओनली लास्ट 2 वीक्स लेफ्ट. सो जो लास्ट 2 वीक्स के लिए जो रटने वाले जो सब्जेक्ट्स बच जाते हैं, या जो जिसमें यू हैव टू रिवाइज इट एट द लास्ट मोमेंट, आर द फार्माकोलॉजी, anatomy, है ना, फार्मा होगी, द anatomy. These are the two important subjects जो last minute you need to revise. Okay, so study hard, मन लगा के पढ़ाई करो. 2 to 3 hours of full concentration पढ़ाई is any day better than 6 to 7 hours just sitting idle or poking at your Insta or Facebook. Okay, so I have a special class on Wednesday, that is on 1st September at 6 p.m. on very important, 3 most important topics of the orthopedics for the NEET PG. and अभी कौन से टॉपिक है, इसके लिए आपको स्पेशल क्लास देखना पड़ेगा. फॉर दैट यू हैव टू जस्ट डाउनलोड द ऐप and subscribe using this code, both of which are absolutely free. Please go and watch this special class. So 3 most important topics, and कौन से most important topics है वो वहीं पे पता चलेंगे. But one, as you all know, is the bone tumors. The other 2 topics you will get to know there, and we'll also discuss about the theory part of these 3 topics which is relevant for your NEET PG. Okay, so अब जो भी अपन पढ़ाई करेंगे till September, that will be dedicated to the NEET PG only. Okay, so this was all about the bone tumors, and if you this was all about the high yield MCQs, today's session. And if you have liked the video, please like, share, subscribe, and you can use my code for the subscribing on the Unacademy platform. And the beauty of this code is not only on the NEET PG, on the NEET UG, the board examinations और the UPSC, जिस भी एग्जाम का नाम लो, Unacademy सब पढ़ाता है. and किसी भी एग्जाम पे you can use this code to get extra 10% off. Okay, so